Perfect. So it's a great privilege to be here, and it's so great to speak after Joanne's lovely talk and this very inspiring sharing. So I am Meng-Chuan Lai. I am a East Asian looking middle-aged man with black hair, so with an eyeglasses. And I'm standing in my room in a condominium apartment in downtown Toronto. We just had a thunderstorm last night, but it was bright and clear today. So what I would try to do today is to share some of my reflections as both a researcher and a clinician, and how I make sense of the research findings related to autistic girls and women and sex and gender in autism. How do I make sense of those findings in daily clinical research practices, aside from learning from lived experiences from autistic people? I have to apologize first that many of the things that we'll be talking about later contains lots of figures and numbers. I'll try to make sense of them. It's pretty heavy because they're drawn from research literature. And also some of those contain medical terminology such as ASD in the context of their publication. I would like to share three major lessons that I learned with quite a bit of research findings there, and also three short reflections about how I make sense of these research findings. So the first findings, which is not surprising to the community at all, is autism tends to be diagnosed clinically later in female than male individuals. And this is really not news because, for example, almost 20 years ago from the United States autism surveillance data, they already identified that the median age of identification in autistic children was about 6.1 years for girls and 5.6 years for boys. And let's not forget that these are the people that back in the days identified being on the autism spectrum or with a diagnosis of autism, who usually are also having other developmental disabilities such as language delay or intellectual developmental issues. There is a trend of increased recognition of autism, especially in the UK. So this is a study that has just published recently, led by Ginny Russell et al., showing that in the GP's clinical database, the annual rate of recognition of autism has actually increased over time, especially for adults and for late childhood. And it's particularly the case for girls and women since 2010. So there's a great increased recognition in the past 10 years. However, the mean age of the diagnosis given to boys is roughly about 12.3 years, but to girls, 14.9 years. So what are the possible factors driving the later timing of diagnosis? I would argue that there are a couple of them. Among them, diagnostic overshadowing being one, what we call expectancy bias being another, meaning that autism has been conceptualized as a boys or men's condition. So if it's presented in girls and women, it's less likely to be expected from the clinician's point of view. There could also be effects from the gender stereotypes that's affecting how the behaviors and presentations are interpreted. So I'm going to give you a few examples about how these factors may play a role. So the first one is from this particular study. This is a study based on a dataset called the Province of Ontario Neurodevelopmental Disorders dataset collected in Ontario, Canada. The researchers asked the question about the age of diagnosis of autistic girls and boys and plot those against the verbal IQ estimated by some instruments. So as you can see, the distribution of age of diagnosis has been later for girls compared to boys already. But the higher verbal IQ estimated from the assessments, the later they are recognized being on the spectrum. And that slope is actually more steep than the one in boys, suggesting that if you are a girl and then you are more verbally articulate, it's likely that you will be recognized being on the spectrum later. There's also other conditions such as ADHD has been shown to be what we call overshadowing the diagnosis of autism. So for example, in this study by Kentru et al, using the Netherlands dataset showing that a diagnosis of ADHD could postpone the diagnosis of autism about 1 year, but that's particularly longer for girls compared to boys. The whole idea that girls needs more clinical issues for clinicians to recognize their autism really stems from this study about 10 years ago already. So this is a study from the UK's general population twin dataset, TED sample. So in this dataset, they found girls who have high autistic traits and also girls who have clinical diagnosis of autism with high autistic traits. They found that those who have clinical diagnosis, a good percentage of them also present with other behavioral cognitive challenges. And that's quite strikingly different from those who have high traits without the diagnosis. Now, there's also a difference in boys, but this difference is not as huge as that in girls, suggesting that clinicians need to see more issues for them to be able to recognize autism in girls. And that finding has been sort of replicated in the Dutch sample. So this is a Dutch sample that includes children referred for clinical assessment. And on the y-axis, it depicts the parent report emotional and behavioral challenges of the child. As you can see, boys who are diagnosed with autism eventually do not have different scores compared to those who do not. But in girls who are diagnosed with autism eventually, they have higher scores of concurrent behavior emotional challenges. Again, suggesting this idea of girls needing more for them to be clinically recognized. But what is probably most convincing is this study led by Alison Rottle in the Washington, D.C. dataset in the States. What the team did was that they had a big collection of dataset of clinical and research participants. They match autistic boys and girls on their ADOS score, which is a standardized measure used by clinicians to gauge autism presentations. So they match them on the ADOS score, meaning that they look quite similar in this data set. But in the data set, girls on the spectrum actually have been rated having higher autistic traits across the board from their parents. And they also have lower adaptive functioning rated by some standard instruments reported by the parents. Again, reinforcing the idea that in clinicians' eyes, girls need to present more for them to be recognized. The other idea comes from this diagnostic overshadowing possibility. So this is a table with lots of numbers, apologize for that. But essentially what it says is that in this Netherlands dataset registry in young adults, they showed lots of autistic boys, girls, men and women show prior diagnosis and co-occurring diagnosis of mental health issues. But what's most important is that what are the diagnoses that no longer present after autism diagnosis being confirmed? Now, we can see a lot of them are personality disorders, mood disorders, anxiety disorders diagnosis, and they're more likely to disappear after autism being recognized, and in girls compared to in boys. So the idea here is that these presence of prior mental health diagnosis may be overshadowing the autism diagnosis, so they are delayed. In order to test whether there is something related to this recognition bias, our chair, Professor Will Mandy's team, conducted this first experimental study by designing some vignettes describing autistic behavior presentations in two forms. One is what they would call male phenotype, which is actually the most typical classical phenotype that clinicians have in mind. The other is what we call female autism phenotype, which I will refer to later as I think more subtle or nuanced presentation. So there are vignettes describing the child's characteristics, and these vignettes are also labeled with different names that imply different genders. So there are two factors. One is the gender of the child, the other is how the behaviors are depicted. These vignettes are presented to primary school educators, and then we ask them how likely they will refer the kid for an autism assessment. So what was found is that the presentation itself has a big effect. the more subtle presentation, the more female phenotype, so-called presentation, the less likely they will be referred for autism assessment. But also, if the name of the child is a girl, then the probability of the educator referring them for assessments would be even lower. So there's an interaction effect there. If you are a girl and then you present in an atypical way in the educator's mind, it's less likely you will be recognized. So I think this quote greatly summarized what we know, what we see here. So this is an ongoing study that Dr. Yanni Handami and I conducted in Toronto with advice by people like Kristen Jenkins, who are, I believe, in the audience. We asked about girls, autistic girls and their parents about their experiences in related diagnosis and support. So this is a quote from a parent saying that this is the autistic girl told him, and this is a teenage autistic girl whose autism was only recognized in teenage. So she said, you know what my problem is? I'm Sheldon, but I look like Penny. So for those people who are not familiar with this, this is the TV series Big Bang Theory, which is quite popular in North America. And so essentially this speaks to the fact that many people or clinicians, educators included, can be affected by the preconceptions of what autism might look like, and also some related gender stereotypes. Now, the third research finding sets that I learned a lot in the past 10 years from the autistic community is that sex and gender related factors can modulate the presentation of autism and the developmental trajectories. Now, there's this trend or this knowledge that has been quite made aware, saying that autistic girls tend to present with less repetitive behavior, less narrow interest, or less so-called RRBI in the clinical literature. So this has been like made aware for quite a while. But what's happening in the literature is that if you use those so-called conventional measures, so these are the measures that has been in the field for decades, people use that for recognizing, diagnosing autism. From this study, which is the largest study to date from Soma Bishop's lab in UCSF, they found that across all the data that they have so far, boys receive more higher RRB score, namely repetitive and restricted behavior scores, than girls. Across the instruments. So that fits with this idea, and also fits to the possibility that maybe clinicians or the instruments are not recognizing autistic narrow interest in girls because of the stereotypical view of airplanes or transportations or dinosaurs being the only possible autistic narrow interest, and missing those narrow interests or fixations that's more prominent in girls. So that fits. But the differences here in the data sets are not hugely different across boys and girls in the data set. So this doesn't lead to using these conventional instruments that you need to consider different thresholds. It doesn't lead to that conclusion. They do find a very important finding that girls tend to have higher scores of autistic traits starting from adolescence. So there's something about developmental stage and the context that does matter. And they point to a very important message that what if there are differences in behavior presentation that's not measured in these conventional instruments? And those may be where the differences lies in, and the nuanced aspect needs to be investigated. So I'm presenting a few examples that we learned from the literature about what those nuances may be like. So the first one is what we call social attention. This is a study, an eye tracking study led by Claire Harrop in North Carolina in the United States. Claire presented video clips of children interacting with each other, either in parallel or interactively. And she invited autistic girls and boys, school age and non-autistic girls and boys. And using eye tracker, they can evaluate how long the child pay attention to the faces of the protagonist. Now, as you can see here, there's a trend that non-autistic boys and girls pay more attention to the face areas, specifically in this interactive dyadic process. However, autistic girls actually pay attention to these areas more so than autistic boys and closer to non-autistic boys and girls. So there is an increased attention to the face areas when looking at these video clips in autistic girls than autistic boys. And autistic girls may be more alike in terms of the time and duration looking at the face areas. So that was interpreted as a proxy for social attention. The other interesting important study is from the Philadelphia group, which basically invited autistic boys and girls and non-autistic boys and girls to have an unstructured conversation. Then they analyze the language sample in the conversation, and they evaluate how frequently the children talked about social events and socially related things. So the first finding is that they found girls in general, autistic girls talked more about social things than autistic boys. But what is most important here is that they analyzed the frequency of them using we and they. So they found autistic boys in this data set very infrequently use we and they compared to non-autistic boys and autistic and non-autistic girls. Autistic girls compared to non-autistic girls use quite similar rates of we and they. But autistic girls use more they than we, which is a reverse to what's happening in a non-autistic girl. So the researchers' interpretation was that autistic girls are very much aware of the group we-they context, but they may be more likely socially excluded. So they use they more often than we. And this finding actually fits very well to the understanding about friendship perception and social motivation in autistic girls. So this is a series of study led by Dr. Felicity Cedric in the UK, which is a classical series of study nowadays. And Felicity went into the school in interview autistic boys and girls and non-autistic boys and girls in special education setting as well as the mainstream schools. So in the mainstream school study, they found that lots of themes generated when talking about friendships are quite common across autistic and non-autistic boys and girls. On the right-hand side, talking about conflicts and different aspects of friendships in boys, and on the left-hand side, lots of things about social networks, friendship conflicts, want to fit in, other things in the girls group. But there's one theme specifically for friends being hard work. This is the theme that only comes up in autistic girls. So the researchers' interpretation is that the friendship experiences of autistic girls are quite similar to those of non-autistic girls, but autistic girls have more social challenges in terms of interacting with their non-autistic peers, so they perceive friends are hard work. In line with that, the final example here is this idea of masking and so-called quote-unquote camouflaging, which is possibly a social coping mechanisms. There's a tons of study, qualitative and quantitative study emerging recently, investigating what this means for autistic people. So Laura Hall in Dr. Mandy's team conducted qualitative studies and then created questionnaires from autistic adults' experiences to tap into the experiences of masking, compensation, and assimilation, which constitutes this idea of camouflaging. So the instrument is called Camouflaging Autistic Traits Questionnaire, which is open access, freely downloadable from the publication itself. So in the questionnaire, camouflaging was conceptualized as a self-report or self-observed motivation and behaviors related to compensating for difficulties or challenges in social situations, in neurotypical social situations, masking in terms of hiding parts of your autism presentation, and assimilation referring to the motivation to fit in neurotypical social situations. So this is one way of characterizing camouflaging by self-report, what we call a reflective approach. Researchers also take other approaches by analyzing existing data. So this is one of our previous efforts trying to use data set that was not initially designed for capturing social coping or camouflaging, but trying to make sense of what, trying to see how we can have a proxy of this behavior presentation by using existing data. So we created this proxy of camouflaging score by finding the differences between what we call external presentation measured by, for example, ADOS, which is a behavior measure, and the internal experiences related to autism, including emotional perception and self-rated autistic traits. And in this sample that was gathered more than 10 years ago, autistic women tend to have higher this camouflaging score than autistic men. But what is most useful is probably observing what's really happening and the real experiences in real life. So Michelle Dean in UCLA back in the days analyzed a data set that they collected by observing how children play in playground. So they classified different playing behaviors on the playground into games, what they call structured games, so people are interacting with each other, joint engagement that children are aside of each other, may not necessarily play a structured games, or children are solitary, being with themselves, be alone basically. So in that particular data set, they found autistic boys and girls are more likely to be engaged in solitary activities and less likely in structured games in the playground. But what is unique for autistic girls is that they tend to have more time being with other children in this joint engagement activity, meaning that they weave in and out, but whether this reflects a good quality of interaction comparable to a joint interactive play or other things is unknown. So what this finding says is that it's probable that if you look from afar, then you see autistic girls with other children, you assume that there's a good social interaction and good quality interaction there, but that might not be the case because autistic girls may just be aside and trying to fit in, and that look like that they are engaging. So this is what they called possible camouflaging by the interaction pattern. This is a study that has been, I believe, presented earlier today by Dr. Wood-Donny, analyzing how autistic children basically interact with the experimenter. So this test called interactive drawing test assesses the reciprocity interaction between autistic children and non-autistic children to the experimenter. What they found was that the autistic girls group actually showed similar levels of reciprocal interaction compared to non-autistic girls, and much more than autistic boys, despite that the autistic girls and boys have similar levels of autistic trait and similar levels of mentalizing performances on cognitive tasks. Finally, all these findings need to be interpreted in the context of the age of the child and the environmental demand. So what is probably happening here should be interpreted in the general population setting. So this is a study led by Dr. Mandy, analyzing the longitudinal cohort in the UK. And on the y-axis is the score called SCDC, which represents social communication related challenges rated by the parents. What was interesting here in the findings is that in the general population, autistic and non-autistic alike, boys tend to have a slight U curve of the score, which is higher than girls already. But girls tend to have increased score from teenage. And at the end of the teenage years, the scores are comparable to the boys already. So this might speak to something happening in teenage years that makes social communication more challenging and difficult, and some of the difficulties appear. And that corresponds quite well, or quite interestingly, to this clinical observation in the Scottish data set. So this is a data set from across Scotland looking at the rates of referral for autism diagnosis in the clinical settings. Before age of 10, the boy to girl ratio is more than 5:1. But starting teenage years all the way into adulthood, the ratio is roughly about 2:1. So there's definitely increased needs for a diagnosis to be recognized in teenage, which is very likely relevant to the context. It also happens in terms of the developmental effect to those who are recognized already very early in life. So this is a study called Baby Siblings Research Consortium, which essentially recruits the younger sibling of an autistic child and follow them from infancy all the way up to childhood. What they found is that for those solid lines, the red being girls and black being boys, these solid lines are those younger sibling of an autistic older sibling who have been diagnosed with autism by age of 3. So in those young kiddo, we know that by age of 3, autistic girls actually have slightly better cognitive development compared to autistic boys. And what is interesting there is that from a data set recruited in Canada, recruiting those who are diagnosed with autism age 2 to 4 and follow them up all the way into school age. If they analyze the group of children and trying to stratify them by the trajectory of their autism presentation, quote unquote, measured by the ADOS, they found there's a group of kids who showed declining scores, which shows maybe less evident autistic features outward recognized by the clinicians. And girls are overrepresented in this declining group. And the same finding applies to a smaller data set collected in UC Davis in the States. And also you can see there's a declining group who, and girls are actually more enriched in the declining group. And this doesn't mean that autistic intensity has changed, but only that the presentation associated with autism captured by the ADOS instrument has changed over time, and it's more likely for girls to show those decline of scores, even they are already recognized early in life. So where do we go from there? And I'm going to spend the final few minutes to share 3 reflections that I have here. The first one is that we always learn from autistic people's experience about what autism is. And that will prompt us to rethink about what autism means. And the definition of autism has shifted over the years from Kenner's ideas of autism to Lorna Wing's ideas of autism, and not to say many of the what we called female presentation, quote unquote, has been described in history by Sulan Wolf, by Chakravarthy, by other pioneers describing clinically in the case. So the better recognition of what's presented, what autism presents in girls and women would actually shift the definition of autism and where the boundary lies. So that's definitely improved recognition, but also there's an iterative process to rethink and redefine what autism is, at least in the medical literature. The problem with the term female autism phenotype is that we know now these understandings, these increased understandings of how autism may present in girls is not specific to girls only, because many of these would apply to gender diverse kids, would apply to boys, would apply to others as well. So I think a better terminology would be, what are the nuanced autism presentations that likely modulated by sex and gender related factors? Not sex and gender per se, but sex and gender related factors, including some biological aspect, some social cultural, gender socialization, and other influences from the context. So it is very important to understand that these are not specific to a particular gender or particular sex, but it prompts us to think about what are the nuances. All the findings are not static, they are dynamic. We're talking about human beings, and human beings grow and develop. And human being grows and develop in the context of interacting with other people. So let's take masking as an example. We know that masking exists in autistic people. We also know masking exists in non-autistic people, and it actually fits to this idea of impression management in the general population. Whenever we are interacting with our conspecifics, we're interacting with other people, there is a social interaction happening. So to what extent I need to mask depends on who I interact with, depending on the context, and also depends on my own characteristics, my own cognitive style, and my own developmental background. So all these interact to contribute to any findings related to what we call masking or social coping, and also the consequences of that, positive or negative. So it's very important to consider the human development and also the context demands. So I'm just referring to one example that we had conducted ourselves. So we were trying to make sense of what may be underlying camouflaging. And we used a secondary data, as I described earlier, 30 autistic women, 30 autistic men. We happen to have a functional neuroimaging data that tap into neural functional activation when one thinking about oneself versus other people. It's called self-referential cognition. We know that the brain area called ventral medial prefrontal cortex actually is related to this. So what our finding was that autistic men actually showed reduced activation in this area when thinking about self versus other compared to non-autistic men, but autistic women showed higher activation here. And also what is interesting is that the neuroactivation in autistic women in this area when thinking about self versus other actually tracks their camouflaging score. So this is a one-off finding, it's a cross-sectional finding. And there could be many interpretations. You could argue that this is something innate to the autistic brain. So autistic women are more wired for monitoring self and others. So, so their activation is higher, resulting into higher camouflaging. But it could also be the other way around, that the social cultural context actually forced autistic women to pay more attention to monitoring what's happening within themselves and other people, which contributes to higher camouflaging scores and higher activation of this brain area. And this is cross-sectional study. So the finding there about the brain needs to be interpreted in the context of the developmental stage of the person, as well as the contextual demand and the social cultural background related to this. So I think this is just an example of how we need to interpret things from a cross-sectional finding, place that in the context of development and environmental demands over the years. The final point I want to make is that our knowledge about autism really only stems from autistic people's experiences themselves. So autistic people educate clinicians and researchers about what we know about autism. If the lens of the boundaries describing autism has already excluded autistic people, some autistic people, particularly maybe girls and women, then our knowledge would be restricted to those who meet the criteria. Now, in many of the studies that we have nowadays, for example, brain studies, if you want to understand how brain works, some of the studies, they need to exclude people because they have to match the different groups. So autistic girls, if they have higher other co-occurring conditions such as epilepsy or intellectual developmental issues or other developmental conditions, they may be excluded from the knowledge, from the generation of the knowledge, the process. So the studies are even further mispresented. Girls are even further mispresented in the study. So the knowledge being generated are even more biased in this case. So if these knowledge are going to be used to support autistic girls, there's the two-tier of exclusion that bias our knowledge. And I think this needs to be recognized very clearly, that we need to improve this in order to have a more comprehensive picture of what's actually happening in autistic girls and women's life. And also because many of these exclusions are related to intersectionality. For example, intellectual disability may actually intersect with autism quite a lot, and specifically for girls. If these girls and women are excluded from studies, then there's no way the researchers or clinicians will be able to learn from what's happening in their lives. So considering intersectionality, not considering autism to be present per se isolated, but how it interacts with other aspects of identities and other aspects of individual characteristics and the context will be very important for us, the whole field, to move forward. With that, I would like to thank everyone for listening and apologize again for the many figures and numbers, and I hope that's not too overwhelming. I'm very happy to share the slides if needed for those people who are interested. I'm happy to have more discussion surrounding all the topics. Thank you very much.